Good morning, I'm Dr. Hiba Ghannoum and our lecture today is acute otitis media. How do we define acute otitis media? It's the acute inflammation of the mucosal lining of the middle ear cleft. What is the middle ear cleft? Middle ear cavity, nasopharynx anteriorly, and mastoid air cells posteriorly. So inflammation of the mucosal lining of the middle ear cleft is called acute otitis media. How does the infection reach the middle ear cleft? The infection can reach the middle ear cleft. The commonest route is through the Eustachian tube. Here, spread of infection along the Eustachian tube and reaches the middle ear cavity. But what are the sources of infection that can cause the spread along the Eustachian tube? طبعا the first source is upper respiratory tract infection. لو في acute rhinitis, acute sinusitis, or adenoiditis, these can act as a source of infection that can spread along the Eustachian tube. Another source of infection is a postnasal pack in cases of epistaxis. If the pack is left for more than 24 hours without any antibiotics, the stagnant secretions will act as a source of infection that can spread along the Eustachian tube to the middle ear. Another source of infection, swimming or diving in infected pools, and a last source of infection is the vomitus or the milk regurg up through the nasopharynx to the Eustachian tube. Also is another source of infection that can cause otitis, acute otitis media. And remember that Eustachian tube in children, as we earlier said in the lecture of the anatomy, is wider, shorter, and more horizontal in children, and this allows the easy access of the sources of infection to the middle ear. A second, less common route of infection is through the external auditory canal. لو patient عنده traumatic perforation of the drum during bathing or during swimming, or if the doctor doesn't know that he has a perforation in the tympanic membrane وعمل له ear wash, this can be a route of infection. A third, very rare route of infection is blood-borne infection in exanthemata. يعني ايه exanthemata؟ يعني conditions with fever and rash زي in measles and whooping cough, a blood-borne infection, but this is very rare. What are the causative organisms that can cause acute otitis media? Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis, more common in children. In some cases, viral infection can precede the bacterial infection in about 20% of cases. What are the pathological stages of acute otitis media? The first stage is the stage of salpingitis or tubal catarrh. What happens in this stage? The mucosal lining of the Eustachian tube becomes edematous and hyperemic, and this causes obstruction of the Eustachian tube and thus creating a negative pressure in the middle ear cavity. The second stage is the stage of catarrhal otitis media, acute catarrhal otitis media, or hyperemia. The hyperemia and the edema will spread to the mucosal lining of the middle ear cavity, and this edema and hyperemia will result in a serous exudate inside the cavity, accumulating in the middle ear. The third stage of suppurative otitis media, or stage of suppuration. In this stage, the exudate is converted into a mucopurulent discharge. This is followed by the fourth stage, the stage of perforation. The increased pressure inside the middle ear cavity will cause pressure necrosis in parts of the tympanic membrane in the pars tensa. and this causes a central perforation in the tympanic membrane. Then there are the two other stages, the stage of complication and the stage of resolution. Stage of complication can even occur before perforation, and the stage of resolution can start in any of the previous stages if we start adequate treatment. What is the clinical picture of acute otitis media? The clinical picture will correspond to the stage of the pathology. What does this mean? It means that according to the stage at which the patient is presenting to your clinic, the symptoms and sign might differ. During the first stage of the disease, during the stage of tubal catarrh, the symptoms are hearing loss and tinnitus. What about the signs? The signs you will find upon examining this patient signs of retracted tympanic membrane. What are the signs of the retracted tympanic membrane? These are very important, and you have to know these 5 signs by heart. The first sign is shortened and handle of malleus, prominent lateral process, exaggerated anterior and posterior malleolar folds, distorted or even absent cone of light, and finally the restricted mobility of the tympanic membrane by sigillization. So these are the 5 signs that denotes retracted tympanic membrane. What is the other sign that you can find during examination by tuning fork tests? You will find conductive hearing loss. What does this mean? This means that upon testing the patient with tuning fork, you will find that the bone conduction in this patient is better than hearing by the bone conduction is better than hearing by air conduction. This is the first stage. What about the second stage, the catarrhal otitis media, the acute catarrhal otitis media? In this stage, in addition to the hearing loss and tinnitus from the first stage, we'll add another symptom, dull aching pain in the ear. This is because of the exudate. If you remember, in the pathological stage, in this stage the negative pressure causes the accumulation of a serous exudate inside the middle ear cavity. It's not pus, that's why it's not a throbbing pain, it's just dull aching pain. What are the signs? You will find hyperemia of the tympanic membrane, especially at the periphery and at the handle of malleus, in addition to the conductive hearing loss by tuning fork testing. The third stage is the stage of suppurative otitis media, where the exudate is transformed into a mucopurulent discharge, so there is pus right now inside the middle ear cavity. How will this affect the patient? The symptoms, the patient will definitely develop fever, anorexia, headache, and malaise. In the local symptoms, now you will find the pain, instead of the dull aching pain, there will be severe throbbing earache, in addition to the hearing loss and tinnitus. If you examine this patient, what are you going to see? The tympanic membrane will be bulging, red tympanic membrane, in addition to the conductive hearing loss if you do the tuning fork testing. The fourth stage of acute otitis media is the stage of perforation. What are the symptoms of this stage? The pressure inside the ear canal, as we earlier said, will cause necrosis and perforation of the tympanic membrane, and thus release of the pus from the middle ear cavity. This will cause the general symptoms to subside. The fever will subside or diminish. The local symptoms, the otorrhea, the discharge will start, and the earache as well will disappear because there is no longer throbbing pus inside the middle ear cavity. The hearing loss and tinnitus will still be there. What about the signs? The general sign, the fever subsides, no fever. Local signs, if you examine this patient, you will find a perforated drum in the pars tensa. Inside the external auditory canal, you will find the mucopurulent discharge, and you can also visualize the middle ear mucosa through the perforation, and it's usually hyperemic and edematous. If you perform the tuning fork testing, you will find the conductive hearing loss. What about a case with presenting with ruptured tympanic membrane, but still the pain and fever persist? What does this mean? If the pain and fever that persists after the rupture of tympanic membrane, this might denote two things: either a small or high perforation that is not sufficient for the drainage of the discharge from the middle ear cavity, or this might also denote the beginning of the stage of complications. Treatment of acute otitis media, this will depend also on the stage. If the patient is presenting before the stage of perforation, then he is advised with rest, light nutrient diet, and plenty of fluids. You will prescribe medical treatment in the form of antibiotics for 7 to 10 days for the inflammation, analgesics and antipyretics for the pain and fever, and decongestive nasal drops to relieve the edema around the Eustachian tube orifice and thus help in the drainage and aeration of the middle ear cavity. What about surgical treatment? Surgical treatment, what is myringotomy? Myringotomy is an incision done in the tympanic membrane. When is it indicated? Indications of the myringotomy will be the failure of the medical treatment for 48 hours. How do you know that the medical treatment failed? By the persistent pain and fever. If after 48 hours from the beginning of the medical treatment still the pain and fever did not subside, then this might indicate myringotomy. Another indication is the bulging of the tympanic membrane. In case of bulging tympanic membrane, it's better to do myringotomy. Why is it better? Because the healing resulting from myringotomy will be better than healing after a pathological perforation. The third and last indication of myringotomy is the development of complications, whether cranial or intracranial complications. If the patient is presenting after perforation of the tympanic membrane, then again he will be prescribed medical treatment, antibiotics according to the culture and sensitivity, and removal of the discharge from the external auditory canal by oral toilet, by suction, or by dry mopping. Surgical treatment, the myringotomy, as we earlier said, might be indicated even after perforation of the tympanic membrane in case the perforation, the pathological perforation, is small or high perforation and insufficient for adequate drainage. Acute otitis media in infants and children. What are the predisposing factors that make children more susceptible than adults? First, the route of infection. We mentioned that the commonest route of infection for acute otitis media is the Eustachian tube. Eustachian tube in infants and children is, as we earlier said, wider, shorter, and more horizontal, so the infection can easily reach the middle ear. What about the sources of infection? Sources of infection are also more common in children, as we earlier mentioned. What were the sources of infection? The upper respiratory tract infections, which are more common in children. The infected material, which are whether the milk or the vomitus. The milk is more common. The children, the bottle-fed children, are more susceptible than the breastfed infants. Why? Why is the bottle-fed infant more susceptible to acute otitis media than the breastfed infant? Because for two reasons actually. Because during the bottle feeding, the child will be lying in a supine position, and this facilitates the regurg of the milk to the nasopharynx. And the other cause is the bottled milk is more liable to get contaminated than definitely the breast milk. What about the vomitus? Gastroenteritis also is more common in infants, and vomitus can thus easily reach the eustachian tube in the supine position. The third predisposing factor is the low general resistance in children in general because of teething and recurrent gastroenteritis. In an infant, what is the clinical picture of acute otitis media? The symptoms: the child will have high fever, vomiting and diarrhea, and this can be mistaken with gastroenteritis, leading to misdiagnosis and delayed diagnosis. Also, the child will be very irritable, continuously non-stop crying, and does not sleep well. He will be pulling or rubbing his ears and moving his head from one side to another. What are the signs? Hyperemia in the tympanic membrane, and remember, don't wait for bulging and don't expect bulging of the tympanic membrane in infants, as we earlier mentioned that the tympanic membrane is thicker than in adults. Treatment of acute otitis media in an infant or in a child is the same as we earlier said, except for the indication of myringotomy. Myringotomy will be indicated after failure of medical treatment for 48 hours. Don't wait for bulging of the tympanic membrane because of the thicker tympanic membrane in children. Why are the complications of acute otitis media more common in children than they are in adults? First of all, delayed diagnosis. Children are susceptible for delayed diagnosis. They cannot express their complaint. They might be misdiagnosed as gastroenteritis, and also the child has a thicker tympanic membrane that will resist bulging, and so this might be considered as an absent alarming sign. Also, what are the other reasons that make children more susceptible for complication than adults? Because of the open cranial sutures, this will facilitate the spread of infection, and the last point, the cause is the low general resistance in children. One of the specific types of acute otitis media is called acute necrotizing otitis media. This is a severe form of the disease. It usually affects infants and young children following exanthemata, as in measles, the conditions with, as we earlier said, with fever and rash. Symptoms are severe and lead to necrosis of the tympanic membrane and the ossicles, and the child usually presents with conductive hearing loss in addition to total or subtotal perforation. This will end our lecture for today with my best wishes. Thank you.